everyone, I'm Leslie Cornwell, certified nurse midwife with Empowering Midwifery Education. This section has to do with understanding explanation of benefits. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only, not intended to substitute for professional, clinical, or legal advice. We've tried to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your unique situation. The course objectives, the students will be able to explain why understanding explanation of benefits is really important. They'll be able to verbalize exactly what is an explanation of benefits. They'll be able to talk about the different aspects of an explanation of benefits and the typical comparison of in-network versus out-of-network, and ultimately what the family owes out of pocket versus what their insurance is covering. It's essential for midwives to really understand, whether it's them directly or they have someone on their team, a biller, a financial representative, an office manager. If you're billing insurance plans, whether you're in network, out of network, you need to have someone on your team that can understand explanation of benefits, answer questions family have, give them an estimated cost of care, review fee schedules, discuss ultimately the families want to know how much are they going to have to pay out of pocket. Explanation of benefits sometimes get a little confusing because depending on insurance plans, maybe the code is correct, but the description they use isn't the one that references a birth center, a midwife. Sometimes families can get anxiety if it says out of network and there's an immense amount that's owed, even though you have an agreement for a cash rate and an out-of-pocket max that they're due based on their financial agreement. So there's situations that can make families very anxious because they don't understand it. So I always stress to midwives in their practices, have financial meetings with part of your new patient orientation. Really good to understand insurance billing in general. This is an advocacy time for not just your practice, but they're going to have to deal with medical bills the rest of their life, especially these young, healthy families having their first babies. They've never touched our healthcare system. They don't understand. Their parents took care of their healthcare bills, charges, insurance processing, medical expenses is very new and foreign to them. So it's really important that we talk about deductibles, co-pays, co-insurance, difference between in-network, out-of-network, out-of-pocket max, ultimate client responsibility, charges we put out, those service locations. They really need to understand. So when you're in the end after the birth, after well woman care, you can easily have a conversation and review what the explanation of benefits, so they don't feel blindsided. So let's go to the basics. What is an explanation of benefits? It's something their insurance company writes to talk about the claim, the medical services that you provided, whether it's an office visit, routine prenatal care, global maternity care, home visit, newborn care, facility fees. You want to make sure your family understands this is from the insurance company. This isn't a charge, a bill for me. They're just breaking down how much they paid, what they covered, what they didn't cover, what you could potentially be liable for medical expenses. And so I really think it's important for midwives to clearly and calmly have a conversation about it beforehand, during the process, and ultimately when they get their final bill from your practice, where all the charges came from. So some people will get them monthly, some people will get them for every single claim. So if you're doing all of a sudden a ROGAM and it's outside of global maternity, they're going to get separate claims depending on how things are grouped for days of service and charges together. It's not a bill, and I stress that over and over again. An explanation of benefits is a breakdown summary the insurance company sends to their subscribers that paid for the premiums. You may or may not owe that additional portion depending on your contract, your agreement, how the arrangements have been set up with your midwife practice. If you're in network, it's very different. They can't bill you the difference. You have a specific obligated amount based on being a preferred provider for patients, versus out of network, you can legally choose to bill the difference to the client. So there's parts of understanding an explanation of benefits that are real specific in particular that midwives need to talk about with their clients, especially at the beginning. I would do a comparison analysis of If you chose to deliver in the hospital, this is the estimated responsibility it would be. And then if you choose to deliver out of hospital with our practice, what's the estimated responsibility? Because families make the confusion. You got to talk about the competition. Just because the Affordable Care Act covers maternity care in network, that doesn't mean every aspect of your prenatal care is covered or is 100% covered, even if your deductible is not met. So you've got a facility, you've got labs, you've got testing, you've got many non-covered services and codes that they bill for hospital charges, and you don't know it till after birth, after the months and months go by of all these charges coming through. So it's really important to advocate and educate so that they're asking the right questions. Deductibles and co-payments are one of the big things that we talk about with our clients. Deductibles is how much they owe out of pocket before the insurance even starts contributing, as long as you're not in network and part of the Affordable Care Act. So if they have a $5,000 deductible, they owe for themselves. You have to figure out if it's a family deductible or an individual deductible, because if it's a family deductible, every member of the family that's on the plan can put a dent in that. So the newborn care, the partner, the other children. Versus if it states they have an individual deductible, that means every single person has to meet this on their own before the insurance does. So for example, if they're $5,000 deductible individual, each person on the plan has to have $5,000 of their own out-of-pocket expenses before the insurance even starts doing these co-payments, the co-insurance. So it's really important to have people understand insurance companies do not pay 100%. Unless you're on Medicaid or a government plan, TRICARE in network, there's certain exemptions to that. But overall, for most midwives, it's cash, it's out of network. Sometimes the midwives will choose to be in network, but co-payments and co-insurance is now a next tiered after deductible where the family has to pay a portion. Co-payment is a flat amount. If you're seeing a primary care provider, you owe $25 at every office visit. If you see a specialist, which is OB services with a midwife, and you're in network, it's $50 co-payment. Whether the entire charge was $100 or $300, you have an exact amount you owe. Versus co-insurance is typically a percentage. That one is typically more of like 70-30, 80-20, 90-10, meaning after your deductible is met, the insurance will start paying. If you have a 90-10, they'll pay 90% of the charges and then you owe 10% of the charges. If you're in network, it's an in-network negotiated rate. What is actually charged, this is important for midwives to understand and clients, what you actually charge isn't what the insurance is going to pay. You could charge $1,000 and that code they reimburse at $100. So there's a $900 difference. If you're in network, you have to write off that difference. If you're out of network, you can choose to bill the family for the difference. So it's really important to have a discussion with your family and for your biller and your staff and team. Whoever is designated to talk about financials with your family has to be very, very well educated in all the aspects of billing to insurance companies. So I would say most of the time for co-insurance it's probably a 70-30, 80-20 split, meaning after the deductible's met, 70-30, the family owes 20% and then the insurance will pay 70% of the contracted agreement or what the insurance companies feel is fair for out-of-network for that code. It's interesting because there's a big difference between in-network and out-of-network with these explanation of benefits and the patient's ultimate responsibility. And I stress over and over again with out-of-network reinforcing to them what you charge and what your agreement says, that financial agreement of how much the responsibility out of pocket max, because maybe you have a crazy high deductible and the insurance didn't pay any of it. I have a lot of families that would panic and be like, oh my gosh, do I just owe you $30,000, $20,000? And I'd say, nope, remember our discussion, your max out of pocket was X amount, you paid your deductible, you've paid your ultimate estimated responsibility of care, you owe a little bit more, you owe a little bit less. Explanation of benefits are not the bills from the practice, so you have to reinforce that to your families. Co-insurance kicks in, co-payments kick in after deductible, and then the next level is annual maximum, out-of-pocket maximum, depending on your insurance plan, how they list it. So this is the level every year, and don't make any assumptions that the calendar year is what insurance plans do, because depending on the open enrollment for that company, I would say most insurance plans they reset the deductible, they reset the out-of-pocket max at January 1st, but don't make any assumptions. Not every single one is that way. When you do a verification of benefits, it should list when is the calendar year that insurance plan resets. It's really important when we do care for pregnant women and it's a 9-month window, we're estimating they're 12 weeks pregnant. If we estimate incorrectly and they're due in January, their entire deductible, everything reset versus they had met it this calendar year. So you have to be really careful in those conversations and educating. This is the opportunity for families to understand and advocate for themselves, not just for your practice, but every other medical bill they're ever going to get in the future, to understand what's being sent to them and ask the right questions. So the out-of-pocket max has to do with every year, once individuals hit this level, the insurance company will pay 100% for what they agreed to on an in-network rate or what they feel is reasonable price for an out-of-network code. So don't make the assumption where maybe you met your out-of-pocket max, but if it's a non-covered service with your insurance plan, it doesn't matter with deductibles, copays, out-of-pocket maxes, because the plan just doesn't cover that service. So just be very careful with certain codes and certain settings and really doing a good job with verification of benefits. Reimbursement checks, we always reinforce to people, explanation of benefits is going to list what the insurance plan is going to pay. If they're in network, they'll typically direct deposit it, send it through the clearinghouse directly to the provider in practice. But sometimes with out-of-network agreements, the families will get sent the check. And so we have to reinforce to people and put it in your financial agreements. If your insurance plan sent you a check being out-of-network, you legally have to send it our way. You'd be shocked how many families think that's their money because they've already paid you something. So it's really important to have an education and put in your financial agreements that if the reimbursement check happens to go for out-of-network coverage to the family directly, they legally have to send it back to you because it's your funds in the first place. So just look at the explanation of benefits, look and reinforce to people. I can't stress this enough. Tell your families, have a conversation with us. Anytime explanation of benefits comes, let's talk about it, because every insurance plan is different. It's not a bill for my practice. It's not saying you owe this to me. It's not. It's just your insurance plan saying this is what we cover, this is what we don't cover. It went towards your deductible, it went towards your co-insurance, it went towards your out-of-pocket max. It was a non-covered service. That's why you owe it 100% and it didn't count towards your deductible. We have to reinforce to our clients the difference between bills for medical care and explanation of benefits. So these are the typical things you're going to see. You're going to see on an explanation of benefits the patient information, their insurance card. You really at the beginning of care want to get a copy of the front and back of their insurance card. Make sure who's the primary insurance holder of the card. Sometimes you need their gender and date of birth, especially if it's like kids under 25 and they're using their parents' insurance plan. It's really important you get as much information as possible. They're going to list on the explanation of benefits who's the provider. There's 2 levels on claims. There's the servicing provider and then there is the supervising provider. So they'll have 2 levels and usually it's the same person, but not necessarily. Like with a PA, an NP, even a CNM in a larger scale practice, there may be the physician listed as a supervising provider and then the midwife, I hate the word mid-level, but the ancillary providers within the team may be listed as the rendering provider depending on the contracts they have. But most of the midwives are going to be independent. They're going to be billing things under their own name. With global maternity care, it gets interesting because you can have 3-4 people taking care of them. You typically bill out for the code 59400 of the person that does the delivery is what you typically do, and based on most CMS guidelines and standards. And then the type of service, the description code, the CPT. Be very, very careful. I've gotten this a couple times with families where the CPT code may be right, but the brief description that the insurance plan decided to put next to that was not right. So we had a couple times where they wrote birth and then the patient transferred, had a traumatic experience, and it was actually for a different service. It wasn't for birth. And so families are instantly getting irate and mad, like, you're charging for my birth. I didn't have a birth with you. And I'm like, Google search that code. The code doesn't mean birth. So So we always have to have a good conversation with our families about CPT codes, and the description the insurance plan decides to put on their explanation of benefits is not always the CMS guidelines of what that description is. So just being very careful and having conversations. The date of service is really, really important. When you're doing multiple charges throughout pregnancy, you'll bill out the day of for the problems, for the newborn care, home visits, birth stuff, global maternity from the very first prenatal visit to 6 weeks postpartum is billed out the day of delivery. If they transferred care from another facility, you'll break up the global maternity care. But it's important that you're having the accurate date of service, because sometimes the insurance companies will audit, ask for additional documentation, and they're not going to reimburse for a charge when you didn't put the correct date of service down, you didn't put the correct code down, you documented one set of care but you're actually billing another. That's called insurance fraud. So you have to be very careful, whether it's intentional or unintentional, that your information is completely accurate on the explanation of benefits. Billable charges. This is the amount that the insurance company says they're willing to cover. It could be your fee schedule, the billable charges of what you're putting out there. And then it's the ultimate part is what I charge, and then what the insurance covers and what they think is reasonable rate for that CPT code is another conversation. The total patient cost on an explanation of benefits, they're listing as the insurance plan, their deductibles, their copays, their coinsurance, their out-of-pocket max, their non-covered services. If you're in network, you legally can't bill them any more than what the explanation of benefits has for covered services. If it's a non-covered service, you can charge them 100% your fee schedule. If you're out of network with them, you can make the option and choose if you want to bill the difference to the family of what after the insurance had processed. So those are good conversations to have with your family, and really being clear. You may have an amazing insurance plan, be in network with somebody, but if their insurance plan doesn't cover home births, they're going to be owing 100% of your fees, no matter if they're in network, out of network. So it's really important to do a good verification of benefits and really have a good sense with your payer mixes in your area. Like, okay, Blue Cross Blue Shield typically covers home visits. We have a couple local payers that don't cover home births, or they'll cover a home birth with a nurse midwife employed by a physician. So like, you have to understand there's federal guidelines, there's state guidelines, and every insurance company can legally make whatever rules they want. So I can't stress this enough to you. When you do your explanation of benefits, you need to verify CPT codes, the service location, and the provider type that you are anticipating are going to bill those services, because I've gotten blindsided on explanation of benefits where I call and they say, yeah, I cover a midwife, and I say a birth center, but their system is a birth center labor and delivery unit. Their system was not specifically an out-of-hospital birth. So we have to be very careful and not make any assumptions when you're communicating and estimating costs of what's covered and not covered. And then it's pretty easy for families to see on the explanation of benefits what the insurance plan's actually paying, and then what they're saying is their potential responsibility. And it's interesting to talk about in-network versus out-of-network, because you're in network, you minimally have much say in the contracted in-network rate unless you're a really large volume practice. So you get stuck with whatever they decide they want to pay you for a code, and then they'll tell you exactly how much you can bill to the family. If you're out of network, they will give you a rate based on what they think is customary and fair for that code, and then you can choose to bill the difference to the families for it. So these are a couple examples of explanation of benefits and reinforcing. It says it at the top for families. This is not a bill. Just keep this for your records. So you want to make sure when you're sending families bills directly from your practice, you're referencing consistently the dates of service, the charges, what they owe, what they don't owe. And then for this example, it was an X-ray. They charged out $20. The balance is $20. The family owes 100% of it. So you want to really make sure that may or may not happen. And then it goes over their coverage, their deductible, the things that are needed, what the family's responsibility is, what the insurance had paid. And then this is another one from Anthem, Blue Cross Blue Shield, just looking at mammograms and another GYN aspect, but it breaks it down. This is the total billed is the charges, the fee schedule you put out to the insurance company, data service 11/21/13. The paid amount is the one section has to do with the insurance paid. Then the other part, because this person was in network, I can tell with the section 7, It's stating this is not your responsibility as a patient because of our in-network negotiated rates with this payer, this private practice. So it's really important for families to understand what was billed, what the family paid, what they're ultimately responsible for. So just as an overall summary, explanation of benefits are really important documents that families will get from their insurance plans for the services that are being rendered for labs, ultrasounds testing, midwives, supplies, specialties, referrals, anything they're using to process their insurance card through. They're going to get a claim that shows a breakdown of what's covered, what's not covered, what the insurance paid, what the insurance allowed based on being in network, out of network, what's covered, and then what ultimately the patient may or may not owe based on the explanation of benefits. It's not the bill from the practice. So it's really, really important that families understand this is just the insurance plan explaining to you what we cover, what we don't cover, what we paid, what you may ultimately be obligated to pay.